So vaccination for women above 40. So life course immunization is the concept of vaccination providing protection and health benefits to people throughout their lives at different stages. With age, we need vaccination to boost efficacy of childhood vaccine, to afford protection when immunity is suppressed due to acquired illness. Despite vast improvements in childhood vaccination coverage in India, adult vaccination coverage is negligible. There is paucity of data on the incidence of vaccine preventable diseases among adults in India. There are no national adult immunization guidelines in India. Screening patients for vaccines. If we screen patients for vaccines, then the immunization coverage will be much more. Screening every patient regardless of the reason for their visit to the clinic. If we start doing that, I think we'll be able to succeed in immunization of almost all of them. Utilize screening tools in the form of health condition, age, lifestyle, or occupation, because if we consider all these factors and we advise the patient for immunization, I think the take is much more. As obstetricians and gynecologists' role, studies have consistently demonstrated when recommendations are coming directly from gynecologists, the vaccine acceptance is 5 to 50 folds higher. So be opportunistic, because everybody, a woman, whatever problem she has, she always asks her gynecologist what to do about it, how to go about it. So I think we should always concentrate on using this opportunity to counsel her for vaccination. So for vaccination, we should think, we should ask, and we should counsel her so that the take is much more. So why we need to counsel? Because vaccination greatly reduces disease, disability, death, and inequality worldwide. And all over the world, we have seen vaccines annually prevent almost 6 million deaths worldwide. And as we all know that India has achieved the elimination of maternal and neonatal tetanus and polio by improving access to immunization. Also, we have, all of us are using HPV vaccination, and we know that the complete prevention of persistent viral infection has been demonstrated in the form of human papilloma virus, which persists in the cervix and which is the precursor for further changes, which in the last stage may go on to become cervical cancer. So if we give HPV vaccination, the clearance of HPV, the papilloma virus is much faster and much more. Similarly, measles vaccination not only protects against multiple complications such as dysentery, bacterial pneumonia, and malnutrition, but it also decreases the morbidity in the children. In India, the introduction of childhood rotavirus vaccination, we all know that it has helped in a long way to prevent hospitalization of many children, almost saving rupees 150 crores in the treatment cost per year. So this is the recommendation by the FOXI for adult and elderly women: TD, Tdap, influenza, pneumococcal, hepatitis A and B, shingles, meningococcal, typhoid, and HPV vaccination. So most of the people, we recommend that these vaccines should always be given: influenza, Tdap, varicella, hepatitis A and B, MMR, and pneumococcal. These vaccines should be given to each and every person after 45 years of age. Historical development in influenza vaccine. From this, we see that the subunit vaccine of the virus, it presents better tolerability and lower reactogenicity compared to other vaccine types. So the take is much more and the side effects are much less. Limited influenza activity is usually seen throughout the year in India, with a clear peaking during the rainy season. The rainy season in the country lasts from June to August in all regions except Tamil Nadu, where it occurs from October to December. So rationale for quadrivalent inactivated influenza vaccine is, this is the market preparation which is available. So quadrivalent recombinant influenza vaccine protects against 4 different flu viruses, usually 2 influenza A viruses and 2 influenza B viruses, depending on the season. and it reduces the severe outcomes of influenza as well as the burden on the healthcare system. So these are the different strains which are present during each season. Research is always done so as to know which virus strain is prevalent during that season, and then the vaccine is made accordingly so that the prevention is at its best. Tdap is a tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis containing vaccine. Tdap vaccine does not have a live component because it is manufactured using inactivated non-infectious bacterial product which generate a robust immune response. This vaccine has been recommended since 2006 for adolescents and adults. A single 0.5 ml dose of the vaccine is recommended. It is given as deep intramuscular injection, preferably in the deltoid region. Concomitant administration of indicated inactivated vaccines, that is Tdap and influenza, is also acceptable and safe, because if we, in one clinic visit, if we give her 2 vaccines to any lady, that helps in reducing the number of visits to the clinic, and the take is much more. Cocooning approach with Tdap, we have seen that if a single dose of Tdap to all caregivers of the infant is given who is less than 12 months old, then the protection to the newborn is much more. And because the source of infection to the baby is from the caregivers. So this vaccine is to be given at least 2 weeks before the delivery of the baby, so that whosoever is taking care of the baby is already immune and does not pass the disease to the newborn child who cannot be immunized at that time. Hepatitis A and hepatitis B vaccines. So for hepatitis A vaccine, it is indicated in people who travel to endemic areas which has hepatitis E prevalence, persons who work with hepatitis A virus infected primates or with hepatitis A virus in a lab. So persons infected with other hepatitis viruses or persons with chronic liver disease not immune to hepatitis A virus, and those who have received or are waiting for a liver transplant. So the schedule is inactivated single antigen. This is very important. Single antigen vaccines are recommended, and 2 doses of 1 ml at 6 months interval are recommended. Nowadays, Trinrix vaccine is also available, which is useful for both hepatitis A and hepatitis B vaccine. They act for both. So the contraindications are previous anaphylactic reaction to this vaccine or to any of its components, moderate to severe acute illness. Safety in pregnancy is not yet determined, so benefits must be weighed against the potential risk. Hepatitis B vaccination, it is indicated for healthy individuals who are more than 60 years without known high-risk factors for hepatitis B virus infection. They may receive full series of hepatitis B vaccination if not immunized already. People at risk for infection by sexual exposure, like sex partners of people who are Australia antigen positive, or sexually active people who are not in long-term relationship, or men who have sex with men, or household contacts of people who are Australia antigen positive, healthcare and public safety workers, people with end-stage renal disease, and international travelers to regions with intermediate or high levels of endemic hepatitis B virus infections, people with chronic liver diseases, HIV or diabetes. So the dosing schedule is 0, 1 to 2 months and 4 to 6 months. No booster dose is required. The minimum intervals between the doses is at least 4 weeks between dose 1 and 2, at least 8 weeks between dose 2 and 3, and at least 16 weeks between doses 1 and 3. If the patient falls behind on the hepatitis B vaccination schedule, even if a year or more has elapsed, continue vaccinating from where our patient had left off. Series does not need to be restarted. Age 20 years and older, 1 ml per dose is required. Chickenpox vaccination for women. So CDC recommends 2-dose series 4 to 8 weeks apart if previously did not receive varicella containing vaccine. So at least 4 weeks after the first dose it should be given. The second dose should be given after 4 weeks. If previously received 1 dose, then only one dose is to be given again. It is contraindicated during pregnancy. Shingles vaccine, it is indicated to reduce the risk of developing herpes zoster and post-herpetic neuralgia in patients with increased risk for the disease. Immunocompetent individuals who are more than equal to 50 years, immunocompromised patients who are more than equal to 19 years of age and are increased risk for herpes zoster, the shingles vaccine is recommended. Vaccine is not indicated for the treatment of these conditions. It is a non-live recombinant glycoprotein E vaccine, RZV, which is preferred over the zoster vaccine live because its protection wanes significantly after 8 years. So RZV requires 2 doses to be administered intramuscularly for protection. The second dose should be administered 2 to 6 months after the first dose. So human papilloma HPV vaccine, all of us know there are various brands available. Indian brand is also there now with the name Servavac. All of us know about it. And the dose scheduling also we know. So getting an HPV vaccine can save 8 out of 10 women from cervical cancer. It can save 8 out of 10 women from vaginal cancer and 7 out of 10 from vulvar cancer, and also men and women from oropharyngeal and anal cancers. Some practical points about HPV vaccines are: pap smear is not mandatory before giving the vaccination. Cervical cytology has to continue as per the screening program, even if the woman is vaccinated. HPV vaccination is recommended even if the patient has genital warts or HPV 16-18 infection has been documented, or LBC with reports of SCUS or any cervical abnormality has been reported. Because all the strains are not, patient is not infected with all the strains. So if we give them vaccination, she gets the protection from other strains. Vaccination with 2 doses of HPV vaccine for ages 9 through 14 years is the recommendation. And after the age of 15 years, 3 doses as per schedule are to be given. If HPV vaccine is given subcutaneously by mistake instead of intramuscularly, then the dose needs to be repeated. It can be administered at the same time as other vaccines, live or inactivated. Pneumococcal vaccine, there are 2 types of pneumococcal vaccines, and one is the polysaccharide vaccine, PPSV, and the other one is the conjugate vaccine. Polysaccharide vaccine is composed of polysaccharide capsule of 23 serotypes, and the conjugate vaccine is polysaccharide is linked to immunogenic protein containing 10/13 serotypes. All over the world, other serotypes of the conjugate vaccine are also available in the form of PCV 15, 20 and 21, but in India, it is only the 13 which is available, and PPSV is also available. PPSV 23 is also available in India. The basic difference is that PPSV has T-cell independent response, whereas the conjugate vaccine has T-cell dependent response with immune memory. It stimulates mucosal immunity. PPSV is its immunogenicity is poor or negligible, and it cannot be given to children under 2 years. Whereas the antibody response with the PCV is much more, and it can be given to children under 2 years. No booster response is seen with the PPSV with the repeated doses, whereas antibody response with multiple doses of PCV are much more. So, effect on nasopharyngeal carriage, it does PPSV does not decrease carriage rates, whereas PCV reduces carriage rate, thereby decreasing incidence of disease. That is, herd immunity is much more with PCV. So the dose schedule is, it is indicated in women of more than 65 years of age, 19 to 64 years, it can be given with risk factors. Chronic diseases like sickle cell disease, leukemia, lymphoma, Hodgkin's disease, multiple myeloma, generalized malignancy. So all these indications, we can use this vaccine. If the person is immunocompromised or having HIV, or patients with chronic renal disease, liver disease, heart disease or lung disease, this is recommended. Age 65 years or older who have vaccines available like PCV 13, 15, 20, 21, and PPSV 23. If they have not received any previous vaccine, then first PCV 13, 15, or 20 is to be given. If the vaccination history is not known, then one dose of PCV 15 or 20 in other countries is the only recommendation nowadays. But in India, since we don't have 15 and 20, so we give PCV 13 followed 6 months to 1 year later by PPSV 23. In immunocompromised patients or those with cochlear implant or CSF leak, PPSV 23 is given after 8 weeks instead of 6 months. Previously received, if a person has received both PCV 13 and PPSV 23, then and if they have received it at the age of 65, then the repeat dose is to be given after 5 years of the last dose. And the dose given is 0.5 ml as a single dose intramuscularly. Typhoid vaccination is indicated in travelers to areas where there is a recognized risk for exposure to Salmonella typhi. Persons with inmate exposure, household contacts to a documented Salmonella typhi chronic carrier, or microbiologists and other lab workers routinely exposed to cultures of Salmonella typhi. So schedule is, there are three types of vaccines available.
नाम निशान आ रहा है मुझे चार्जर कार में रखना चाहिए शायद
Dr. Preeti,
The first vaccine is V1 polysaccharide, 0.5 ml dose administered intramuscularly. This vaccine should be given at least 2 weeks before potential exposure. TY21A is the oral form, one enteric coated capsule taken on alternate days 0, 2, 4, and 6, for a total of 4 capsules. All doses should be completed at least 1 week before potential exposure. Nowadays, people prefer giving typhoid V1 conjugate vaccine till 45 years, which is the only single shot is required, that is 0.5 ml intramuscular. Contraindications include acute febrile illness or acute gastroenteritis and immunocompromised persons. And conjugate vaccine is contraindicated in pregnancy and in lactating women. MMR is in non-immune individuals. 2 doses of MMR vaccine should be administered at least 28 days apart. The dose of MMR is 0.5 ml to be administered subcutaneously at upper outer triceps. Thank you.
Thank you, Dr. Can we have the
I have a question actually.
Yes.
I just wanted to ask a question
yeah, Dr. Ruchi, carry on.
about pneumococcal vaccine. Should
Yes.
all VR 60 plus should receive this pneumococcal vaccine routinely?
So whatever protection you can do, there is no harm in taking the vaccine. One should take. The recommendation is whosoever wants to take whatever vaccine should take.
Okay.
Unless and until you are allergic to the ingredients or you have had allergy in the past for the preservatives which are used with the vaccine. So
Pneumococcal is advised 65 above, not 50 above.
nowadays the
not
latest recommendation is 50 and above, and PCV 21 is also available internationally, but in India only 13 PCV 13 is
10 and
available.
13, yeah.
PPSV 23 is available.
right.
Dr. Vandana.
Yeah, excellent. The recommendations have to go, and these are to protect because of waning immunity as we age. These vaccinations are advised, and definitely Dr. Renu pointed out that there are no guidelines from the government side. They should be forthcoming so that people get a important message that these are mandatory, because they are all the vaccines are a little bit expensive. That is the
Right.
reason why the people are a little bit less receptive to the consultant or the clinician, because there are no recommendations from the government, and they are absolutely necessary. They have to be taken timely to
Because
protect
in
yourself. Yeah.
person they repeatedly get pneumonia in these seasons. So I think one should take pneumococcal vaccine at least after
People who
65.
have got lung disorders and all that, or COPD, for them it is definitely there for general public also. Like you
Yeah, yeah.
never know when you get influenza vaccine is one which can be easily taken.
Every year one should take.
Every year it has to be taken, right? So
And if
these are
you
the-
are not sure about your take on
Yes, ma'am. Yes,
TD,
ma'am.
take one dose and then take TD every 10 years. One dose should be taken every 10 years.
Let me just tell you that all these vaccinations are meant to be taken. Because if you take it, you can take it from me, 90 to 95% of your illnesses will be prevented.
I think every time once if elderly person visits to us, we should advise about these vaccinations.
तो ना
We
पहले
should
तो खुद तो लेंगे ना. We are elderly. Let me be frank with you. मैं और Dr. Uma Rai and Dr. Sangeeta will talk about. Dr. Chandrata will talk about. I take flu vaccination without fail for the last 20 years. Me, my family is taking. My husband, my mother-in-law. So promise today that each one of you will be taking it.
Right.
Promise करो.
बिल्कुल ठीक है
I'm
मैडम.
ले रहे हैं, I'm already taking.
हाँ, we are taking.
लेना है. इसमें कोई भी compromise नहीं करना.
I am giving to everyone at my staff also, 45 and above.
It is really wonders. I will give you an example. My husband had Bulan Bari, and today I'm in practice and living a medical college is because of the influenza problem. Okay. Now, secondly is people like me have taken pneumococcal. How many of you have taken it?
Not taken.
People who past 50 years have not taken it.
Taken.
Must take it.
Pneumococcus.
थोड़ा सा इन्वेस्टमेंट जरूर है पर लेना जरूरी है डॉक्टर साहब.
Pneumococcal तो इतना महंगा नहीं.
Shingles also is
5,000 रुपए
recommended.
का कुछ ऐसे था. अब shingles है, now it is cost something like 10,000 one dose. 2 doses have to be taken. Each one of you have to take. अगर आपने किसी को shingles देखा है ना, उनका टॉर्चर देख के ही आपको ये वैक्सीनेशन की याद आ जानी चाहिए.
हाँ मैम, मेरी अभी एक पेशेंट को हुआ, उसकी दोनों आंखें ही बंद